And the reason for that is anatomically they're very close to each other. And if that develops, one thing we need to make sure of is that when we take the tooth out, sometimes the tooth, what we call the tooth root, which is the top of the tooth, actually pokes into the sinus. And when we pull it out, it's like pulling the plug out of the bath. You're left with a hole. So that hole we call a fistula. So, and if that develops, it will often usually just close over by itself, but we can surgically close those fistulas. And then when we get a seal, if that sinus was otherwise healthy to start with, then whatever sort of builds up in that sinus because of the communication between the oral cavity and the sinus will usually settle itself down. But they're really good candidates for then, all right, let's put some medication on it, because if they never had a sinus problem, it's probably just pure circumstance that this has stirred things up. So we can use those nasal sprays, those steroids, and I forgot to mention the salt water and the saline that goes into the nose as well, and maybe some antibiotics. And if it doesn't clear up, then they maybe just, some people have unfortunate consequences, and one of those consequences is they can end up with an infection that gets in the sinus that we just can't shift or budge, in which case, good case to go surgically, open that sinus up, just wash and rinse it all out. And if that's their only problem, that's actually a pretty low-end procedure in the big scheme of life. It's day surgery in my hands, not much discomfort, and a pretty good straightforward recovery. So hopefully that sort of answers your question and gives you a little bit more on that one.